Work me through this.
Okay, so which of the following is the most likely diagnosis? The options are condyloma acuminatum, lichen sclerosis, penile melanoma, squamous cell carcinoma, and syphilic chancre.
Okay.
And then the case, so a 60-year-old male presents to the urologist with a firm ulcerated lesion on the glands of the penis. He reports that lesion has been present for 6 months and has gradually increased in size. He denies any pain or discharge, has a history of smoking, and has never been circumcised. A biopsy of the lesion is performed, and histopathological examination reveals invasiveness of atypical squamous cells. So, based on that last part, the results of the biopsy, I could probably rule out, and that in addition to like no discharge, that's pretty characteristic of things like gonorrhea. I would probably rule out the infection as a cause. So, condyloma acuminatum, syphilic chancre, and lichen sclerosis, I think, is associated with like the vagina. So, I'm not sure if that presents in males. Penile melanoma or squamous cell carcinoma. Um, so I would most likely guess that it's squamous cell carcinoma.
Okay. Do you
Just
want to
based
keep
off
it
of
or
the,
change it?
yeah, I would keep it because I'm not sure what the melanoma would look like.
Okay, good. The answer is D. Let's work through this together a little bit here. So older male, right? So anytime someone is older, that is a risk factor of cancer, right? The older you get, the higher chance of malignancy. Okay. Firm ulcerated mass. Okay. So any kind of firm and ulcerated lesion, you got to be thinking to yourself, that's not good. That's a breakdown of skin and it's hard, meaning that the reason why cancers are usually hard is because they invade into things. Okay. So they become a mass. Reports the lesion has been there for 6 months. So it's a chronic thing, right? So cancer is more chronic.
Okay.
Okay. And it has gradually increased in size. So a lesion or mass that has increased in size for the past like months is always screaming cancer to you. Denies any pain or discharge, which is great, right? That tells you it's not gonorrhea, it's not chlamydia, it's not infection like you're telling me, right? Has a history of smoking, never been circumcised. Smoking always kind of, you got to think, in this case, it doesn't deal much with the cancer, but smoking has a lot of, cancer risk factor. And then biopsy. When you do a biopsy of something, is that sensitive or specific?
Hmm.
Okay,
I'm
so
not sure. I would say that it's specific.
bingo, it's very specific, meaning that that piece of information is going to be like the highest value. Does it make sense?
Right.
So I'm give me a symptom or physical exam finding that is sensitive.
Mm, so,
So like a fever, right?
okay.
So if you have a fever, that just means you're sick. That could be infection, that could be cancer, that can be you ran a marathon, that can be anything, right? So a
Right.
fever is very sensitive, but it's not specific towards a certain disease process, right? Or diagnosis. But a biopsy is very specific. Okay. So I'm glad that you kind of zoned in on it because the biopsy is going to tell you the most specific information, which is atypical squamous cells, right? And under, right, which is not good. That means that you're thinking squamous cell carcinoma, right, which is cancer. Okay. But let's talk about some of the other answers. Condyloma acuminata, right? So, and then syphilic chancre, like I said, you're not worried too much about infection. Lichen sclerosis, right, can lead to it has a higher increase of risk for squamous cell carcinoma, but that's going to be kind of these white streaks that are dry, and usually they kind of test it in a woman or a vagina, right? And penile melanoma, right? You're going to see, melanocytes that are kind of underneath the basement membrane that you're worried for melanoma, right? But they're telling you specifically that it's squamous cell, so you know it's squamous cell carcinoma. Okay.